Do you know what NCD stands for?
NCDs?
NCD.
NCDs.
Can I guess what NCD stands for? National...
Cancer or catastrophic?
I think the D stands for diseases, correct?
I don't know.
I'm not sure.
I have no idea.
Not a clue.
I'm the World Health Organization's Global Ambassador for Non-Communicable Diseases. And NCD stands for Non-Communicable Disease. It's something that you can't catch. You get it from something else. Obesity, heart and respiratory problems, diabetes, cancer. Those things don't come from somebody else. They come from things acting on you or that you develop in your body. An unhealthy diet, pollution in the air, these are things that we can do something about, and so government really can help people prevent non-communicable diseases.
How have NCDs affected people you know?
My father, he passed away. He had type 2 diabetes. His toe was amputated.
When I was 25, my father had a massive coronary.
My dad died from emphysema. I really don't think they knew any better when they started smoking how bad it would be for them.
My grandma, she had the diabetes.
My grandfather had heart disease. If he had known that they were warning signs, I think that would have definitely helped his quality of life.
Non-communicable diseases, people think they're inevitable. They're not inevitable. We can prevent most of them. Shockingly, while 2/3 of deaths in low and middle income countries are non-communicable diseases, they get only 1% of the funding.
1%, okay, wow.
That's definitely not a good percentage at all.
That seems awfully small for the percentage of people who are dying from these things.
Why is it so low? I don't understand that. What do you do to change that?
We work with the World Health Organization to advocate for better laws and policies that will reduce NCDs. And one major initiative that we're involved with is getting 50 cities to work together to implement proven things that will save lives. Our foundation focuses on meeting unmet needs, and when we got started, there were not a lot of people paying attention or funding work on NCDs. But we knew from experience that combating tobacco and obesity in New York City could just save millions of lives with just a few interventions. Health Department surveys show that smoking among adult New Yorkers has decreased by 31% since 2002, and smoking among teenagers has also dropped dramatically. We implemented public health reforms and bans on smoking in public places, despite a lot of intense industry opposition.
I believe that initiatives like that would definitely make for a better, healthier place to work and to live.
If you have a body of law, and if you have a body of policies in place, I think you go a longer way to do that.
To have programs and centers right there within the reach of the community.
Increased public service announcements.
Potentially the whole world could really benefit from that kind of action.
For the first time in history, non-communicable diseases kill more people than communicable diseases around the world. And unless we do something to encourage healthy choices and convince people to take care of themselves, this problem's only going to get worse. Nevertheless, these are tough causes, and governments have to get help from private philanthropy to take on the private sector that doesn't want this done.